that are the shock troops, the first line of defense. Those are called the what? Hey, man. They love neutral dye. They're called, right, neutrophils. We talked about the cells that eat, right? Macrophages. We talked about the cells that give you allergies. They're called the mast cells. We talked about the killers. They're the T cells, the CD8, right? We talked about the helpers, the CD4s. And now we're talking about the B cells, the guys that actually make the antibodies. When our friend Gregory gets vaccinated against the flu, like a good guy. We got one last cell, okay? One last cell. So it turns out that the innate immune system lives in your tissues, right? The adaptive immune system lives in your lymph nodes. We know what a lymph node is? It's like here, you can feel your lymph nodes when you're sick. They're big, right? Sometimes here, right? So there's got to be a way to get information from the tissues, right, where the innate immune system is working, to the lymph nodes, where the adaptive immune system is working. And that's a special cell that was only discovered about 15 or 20 years ago, and which led to the Nobel Prize last year. These are called dendritic cells. Now, if I didn't tell you these are immune cells, does anybody got to guess what kind of cells they look like? They look just like nerve cells, right? They look just like nerve cells. They have these long projections. Now, not at a risk to offend you, sometimes I give lectures to urologists. Urologists are surgeons. They take care of patients. They take their prostate gland out. They take their kidney out. They don't remember immunology. You guys now know more immunology than most of them, right? So I tell them, they say, how do I think about a dendritic cell? Again, this will be somewhat insulting. I say, you think of it as a teenager. Okay? So what they do is they kind of, maybe it's my son in particular that does this, okay? So you sit around eating and eating and eating. Okay? So dendritic cells live in the tissues, constantly sampling their microenvironment. They just eat and eat and eat and eat. They can eat their own body weight in fluid 10 times an hour. They're just eating and eating and eating. And normally, they do nothing. They just sit there on the couch, right? Now, if Gregory was on his couch and eating and eating and eating, right, eventually he's going to eat a bad burrito. Eventually, something's going to get him going, right? So something's going to activate him. Once he gets activated, he's going to stop eating, right? He's going to get up off that couch, and he's going to show the world what he's eating, if you know what I mean, actually. So that's what these cells do. They sit there, they sample their microenvironment, sample, 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 until something tells them there's danger in the world. There's a bacteria. You ate the bacteria, sorry. That was like Mexican bacteria or something like this, right? Then they get up and they leave. These cells, they leave and they go to the lymph nodes to bring in the rest of the immune system, the adaptive immune system. So that's what they do. They're called dendritic cells. Again, mostly eating and eating and eating. Eventually, they get signaled to be turned on. The signal is usually something for bacteria or viruses. And then when they get that signal, say, stop eating, and then go to the lymph node and get some T cells, essentially antibodies into the game. So that's how they work. In that way, they're sort of a little bit like sentinels. They're sort of just in the tissue looking for an infection. They're looking for trouble, okay? So that's the dendritic cell. These were really only discovered, honestly, about 20 years ago, and they led to Ralph Steinman getting the Nobel Prize about 2 years ago, actually. So these are kind of cool cells. So this is the hard part, okay? This is the part that, like, when you get these questions on your AP exam, you will now know it's going to make it easier, okay? So all these cells kind of have to talk to each other in some way. And they talk to each other with chemical messages, okay? Chemical messages. The chemical messages are 3 basic kinds. And if you know the kinds, you win, okay? You just got to know the kinds. You don't have to know the particular ones, all right? So the big class of chemical messages is called cytokines. Cyto means, who's like a big weight? You lift weights? Yeah. So when you drink this stuff called Cyto Max, you ever drink Cyto Max, man? No? Okay. So cyto means cell, right? So cyto means cell, and kind. Everybody know what kinetic is? Motion. So this is cells in motion. So cytokines are sort of orders. They tell cells, they give them directions, and they give them orders, right? So for example, one example of a cytokine is called interferon. It interferes with viral infections. That's where I got it. You don't have to know that interferon so specifically, trust me, okay? But you got to know it's a cytokine. And what happens is sometimes a macrophage will eat up some bacteria. right? And it's just not doing its job. It's trying to dissolve that bacteria, particularly mycobacteria, which are tuberculosis. Just can't eat them, right? Just can't kill those suckers. But then comes in your favorite cell, your helper T cell, right? Comes in and gives a little help. It sends a little signal called interferon that fully activates the macrophage. So it's an order. You, get activated. Kill those stupid bacteria, okay? So that's one example of a cytokine. And it's a direction. It says to the macrophage, fully activate yourself, get your butt off the couch, and kill those freaking mycobacteria, okay? A cytokine, a cell move, do something, okay? So that's one kind. Chemokines are more specific. Chemo is what? Everybody knows chemo. You know chemo, right? Chemo is chemical, right? Yeah, chemical, right? So it's a chemical that tells somebody where to go. Okay? Chemokines. Chemokines basically are things that attract cells from the immune system. And I'll show you the example of this later. So imagine you have these bacteria inside your skin. This is your blood vessel up here. These are the endothelial cells. And here's the neutrophils, right? You need those neutrophils to get into the skin to make some pus and to kill the bacterial infection, right? How do they know to go there? How do they know that you have an infection? The way they know is these chemicals called chemokines. So the cells in the tissue will release a chemokine, and this is the name of one called IL-8, which you should not remember. But it kind of diffuses out, and the neutrophil is going along, and it smells it, essentially. It senses it. It stops, and it sticks to the blood vessel. And it's kind of cool, actually. I wish I had videos. It starts rolling along, and then it's, and who said this? You said this before, didn't you, about like the nucleus? It kind of squeezes through there and gets in, and then it can do its job and kill the bacteria. Okay? So chemokines are chemicals that tell cells in the immune system where to go. Okay? Got that? Cytokines, chemokines. One last one. Okay? This one is, I don't know if this is on AP, but it's actually worth thinking about. It's called interleukins. Okay? So again, what does inter mean? Between. Between, perfectly. It's between. Leukin comes from leukocyte. All these cells are white. Every cell we talked about here is white. Okay, they're all white blood cells. That's all leukocytes. Okay, so it's a way to communicate between white cells. And again, don't worry about the kinds, but basically there are two big classes. One tells you to kill, right, and one tells you to make antibodies. All right, two broad classes of interleukins. But inter, between, leukins. This is how lymphocytes and leukocytes talk to each other. Okay? So those are the chemicals. This is definitely on your AP exam. I saw it. Okay? So now I saw the old one, so this is definitely on it. So there's the immune system is divided broadly into two parts: the innate and the adaptive. But the organs are divided into primary and secondary. Okay? And this they always ask. And again, I don't know if it's not important to me, but it's important to them, so it should be important to you, right? So primary is where the cells come from. So we already learned from our friend here who was hiding on camera, now I can see him, that T cells come from the thymus. Right, so this is where they come from. So you think it's a primary or a secondary organ?
Primary?
Correct. So the thymus is a primary lymphoid organ because that's where the T cells come from. Okay? And somebody else told us the B cells come from the what? Right, so the bone marrow, where the B cells come from, is a, yeah. It turns out that almost all these cells, neutrophils, macrophages, most of them actually start in the bone marrow originally. In fact, even the T cells, they start in the bone marrow, then they go to the thymus, right? That's not that important. The important thing is that there's primary and secondary immune organs, and the primary ones are the what? Come on, quick.
Oh, the ones that produce it.
Yep, and what are they?
The thymus.
And the
bone marrow.
Brilliant, okay. So the secondary lymphoid organs are where the cells in the immune system talk to each other. And we kind of mentioned it before, and I mentioned it before on purpose, actually. So one is the lymph nodes. And then there's this other organ underneath your ribs here. It's called the spleen. Anybody ever your spleen? We'll talk about it. So the spleen actually is another secondary lymphoid organ. In animals, spleen is where most of the antibodies actually get secreted from. Okay? So primary, bone marrow, and thymus, secondary, spleen, and lymph nodes. Lymph nodes. Where are your lymph nodes in your body? I keep pointing my neck. Are there any place else you got lymph nodes?
I had a small lymph node in my armpit once.
Oh, they have a small axillary lymph node. That's nice.
It hurt a
actually.
lot.
Correct. And it was swollen, so it was hurt. And it had inflammation, so it had rubor, calor, dolor, and tumor. Yes. Any place else you guys know there's lymph nodes?
Are they on your like lower back or sides?
Yeah, so there's some inside your lower back. There's some inside like your groin area. There's some behind your knee. There's some actually in your elbow. It turns out that, here, stand up for a second. So it turns out that when sailors got syphilis, right, sometimes they would get inflammation in the epitrochlear lymph nodes over here in your elbow. So what they would do, so when they were meeting, like when a father was meeting a sailor that was going to date his daughter, he'd go, this is like this, hey, how you doing? And he was feeling here, for the lymph nodes, right? So when you felt big lymph nodes, that meant the sailor might have syphilis, and should not date his daughter. It's called the sailor's handshake, actually. So you can have lymph nodes in your elbow like that. Essentially, they're all over your body. It turns out that most of them are none of those places, actually. Most of them are someplace you probably didn't think of. When you were evolving back many years ago, what was the major problem of stuff that would be toxic to you in the environment? Where would most bacteria come in? Remember, you like run into the jungle, just like, you're hungry, you just pick up stuff and eat it. Absolutely. So the majority of the lymph nodes, the majority of the infections that we were exposed to during evolutionary times were GI. So it turns out the vast majority of lymph nodes are in the gut. So in the stomach, colon, like that. So when we dissect a mouse, we want to take out their lymph nodes, and we can get about 100 million cells from the gut. And from all the rest, we can only get about 50 million. So the majority of your lymph nodes, even though you like your epitrochlear one, your sailor's node, right? Like that, the ones that are most common is actually the gut.
Are lymph nodes visible to like the naked eye? Or?
It's a great question. So yesterday I had a patient in clinic, right? Young guy, history of testicular cancer, and he comes in and I'm looking at him and like, dude, what the heck is that? So he had a huge lymph node on his neck. It was 2 centimeters by 1 centimeter. We better take a look at that one, friend. So sometimes, normally they're not actually, but if they're swollen or you have an infection, they can be actually. Particularly the neck ones are the ones you can often see. Sometimes you can have cancer in the lymph nodes called lymphoma, and then people will get swollen lymph nodes that you can see a little bit easier. But usually they're not. That's a good question. So those are the it's the playing field, and those are the primary and secondary lymphoid organs. Okay. All right. Now's the good part. Okay. This is the last part of the lecture. You guys are all doing great. You're asking questions. You're looking sparky. How does this all work together? This is why immunology is both easy and hard. It's hard because you like learn all those cells, and some of you people will go home and memorize them, and that's good. You do good in your APs, well on your APs. But sometimes it's better to think of it working together. So how does it work? And this is a typical example we use. So again, I just picked on my different. Gregory. So Gregory was out there playing soccer. Some dude like tripped him, right, and he falls down. He sticks his finger in the ground, and there's a freaking splinter, maybe an old metal can. It goes right into his finger. That splinter is covered with bacteria. Ooh, this is not good, right? So what happens is the bacteria multiply really quickly. Bacteria can have doubling times as short as 30 minutes. And those suckers are growing. They're under his skin. He might not even know now. He just kind of spit on it, put a little water on it, walk away, right? Meanwhile, those bacteria are multiplying and multiplying. What happens is the innate immune system. The innate immune system senses them. Bacteria have products and chemicals that are sensed by cells like macrophages, particularly macrophages. Macrophages are kind of stupid. They just kind of eat things in general. They're really not so smart. So macrophages start eating them up, and then they release chemicals to say, oh, we need a little help here. Okay? So first, start with bacteria. Gregory's bacteria are eaten by his macrophages. Now this starts getting bad. At first nothing happens, but then they release chemokines, which says, come help me, and cytokines would say, something's going on here, right? Meanwhile, in the adjacent blood vessel, these cells with hypersegmented nuclei are rolling through, right? What are those cells? Neutrophils, right? So we need to get some of these suckers in the game, right? So what happens is they sense this, and they migrate through the blood vessel wall, they squeeze through quite beautifully, and they come into the area where those bacteria are. As this happens, fluid leaks out of the blood vessel, right? Making that finger get bigger. Okay, so bigger is out of those things. It's rubor, callodolar, tumor, that's swelling. So now Gregory's got a swollen finger, maybe it's the middle one, he's showing her, check this out. Swollen finger, right, and it's turning red, right, that's the rubor. So the bottom line is the cells start coming, and then now the neutrophils start coming out. So if we came to Hopkins and there was a young intern, where's our Hopkins person? Now you're a young intern, you're on service, big swollen finger, this looks bad, we better open it up, right? Why not, right? So if you opened it up, you would see these white neutrophils in there, and that would be what?
A sign that the infection is being
Right, that would be a sign that he's fighting the infection. And we would call that some laudable pus, right? Some happy pus, laudable, we love it. So it's fighting the infection, so now there's neutrophils. They start to fight the infection. But Gregory's immune system is a little smarter than that, okay? It wants to remember this bacteria, so the next time somebody kicks him, when he falls in soccer and gets this, he'll fight the infection faster. So to do that, the cell that connects the innate to the adaptive immune system gets in the game. And those are the dendritic cells. So the dendritic cells were sitting in this tissue just sort of happily drinking and drinking and drinking. But when those bacteria came, right, they got activated. They stop drinking, and they take the stuff that they've seen around them, and they leave. They leave, okay? They traffic through these vessels called lymphatics to get to the lymph node. So if the infection was in his finger, the first stop would probably be here, the epitrochlear nodes in the elbow. Then who had the axillary lymph node? Like that. So they go, and it's actually fascinating. These cells move through those lymphatic vessels like grease light. It's amazing. Right through. They move in just a couple of hours. So now these cells go to the lymph node, and this is where we get the adaptive immune system. In the lymph node, you have your T cells and your B cells, right? T cells are going to be important in killing. B cells are going to be making antibodies. So here's a lymph node. This is a kind of complicated picture, but the bottom line is that the dendritic cells come in through here, through the outside, just like a capsule. Looks like a kidney, right? But it's not. It's a lymph node. So the dendritic cells come in through here, and here they talk to the B cells. What they do is they activate specific B cells, and the B cell's job is to make what? Antibodies, right? So now we're going to make specific antibodies, actually. The making of those antibodies is helped by a helper T cell, which is also known as a CD4 T cell. CD4 is the helper, right? So CD4 T cells, they live here. B cells live here. And now the antibodies get secreted. They go all over his body. Now you're in good shape, okay? Because what's going to happen is those antibodies are going to get into that tissue, and they're going to help you fight the bacteria. They help you fight the bacteria in two major ways. One way is they just sort of bind up toxic molecules that the bacteria make. We call that neutralization. Okay? So neutralization. The other thing is some bacteria are really hard for macrophages to eat. They're covered with a slimy, slippery glycolipid coat, right? They're slippery, right? So your macrophages try to grab them, they just can't grab them, right? What antibodies do is they sort of coat them, and they give the immune system a handle. Now the macrophages and neutrophils can kill these bacteria and take them up. Don't worry about that part here. So again, neutralization and optimization. You recognize the antibodies now, right? The little Y's, right? Okay? So they're binding up the toxins, they're getting rid of this, and so then eventually his infection goes away. Right? The B cells that made these antibodies and the T cells that recognize the protein do a really cool thing. Okay? So the first time you get an infection, the y-axis is how big your antibody response is, right? How many antibodies you make. And then this is time. So the first time what happens is it takes, the antibody response is about this strong. It takes about a week, honestly, maybe even longer to get a good antibody response. So you get an antibody response, it takes a little while, and then it sort of fades away, but you've always got a couple antibodies around. Like when you got your flu vaccine or your pneumonia vaccine, these antibodies are sitting around. The second time this happens to our new friend, what happens is now the immune system is already starting from a higher point, and it's faster. Boom, right? So it's faster, higher, and stronger, actually. So that's what memory is. And this is the medical system. We asked them on the exam, so if you know this, you're getting your head of the medical system. Okay? It's faster, stronger, and it's actually more specific, too. So that's what kind of memory really looks like. And it, you know, when you go to med school, everyone's going to med school, we have a whole lecture about memory, actually. It's kind of interesting the way it works and things like that. But again, the whole purpose of the secondary immune, or the adaptive immune system really is to make memory. Okay? So that's sort of how it all works together, right? So when you first hear it, you're like, neutrophil, what the hell's that? You know, macrophage. But when you think about it that way, with the splinter idea, it all makes sense. It all works together. Right? Nothing works by itself, really. Okay, so here's a summary. There's a lot of cell types, but not too many. Okay? We talked about the cell. You should probably know what the cells are, their general role. We talked about the innate versus the adaptive immune system. We talked about the adaptive being the B cells that make, I should have said antibodies. Immunology is just another word for antibodies. So B cells make antibodies. T cells, we've got your helpers, we've got your killers. We talked about the chemicals. And again, the bottom line, the reason I kept doing those sports things is because the immune system is a team effort, right? No individual part does everything by itself. All right? So I have a few review questions, but before that, you guys could ask me questions. Okay, any questions? No? Please.
So except for you guys are beginning, you have the child probably
Yeah.
expect to treat or looking like basically something that's for short.
Brilliant, actually. So up until about 20 years ago, he would be expected to live only for a while because the bubble was not a perfect containment situation. You would give antibiotics. Antibiotics don't work so well even if you don't have an immune system. So up until recently, as in 20 years recently, he'd be expected to die, right? Any way you could think of fixing that? So where did I say all the immune cells sort of originally come from? The bone marrow, right? So what if we took that kid's bone marrow out and put in fresh new marrow and let him get rebuilt from the new bone marrow? That procedure, somebody said it's a bone marrow, actually everybody said it's a bone marrow transplant, actually. What that involves is first getting rid of that guy's immune system, or that kid's immune system. How would you get rid of somebody's immune system? I do it actually on purpose in the clinic once in a while. How do you think I'd get rid of people's immune system? So remember, I'm an oncologist, so I treat patients with cancer, so I give them, yes, so chemotherapy. So high doses of chemotherapy can blow away your immune system forever, and we can put in a fresh new one that has space to take, right? So that's one way. Another way is radiation. You just radiate the heck out of them. Get rid of their immune system, and then put it in the immune system. And sometimes, usually for bone marrow transplant, we use a combination of those. So nowadays, those patients can be treated, some of them actually, with a bone marrow transplant. It's a great question, actually.
When you do a bone marrow transplant, do you take out all of the bone marrow in a bone?
Oh, no, it's a great question, actually. So bone marrow transplant, we take a patient usually to an operating room, and we take bone marrow from the hips. Usually about 10 needles full. If you're awake, it kind of hurts a lot. If you're not awake, it doesn't hurt very much at all. So it's only a little bit, actually. These cells are brilliant because they can really proliferate a whole bunch, right? So you really don't need so many cells. In a mouse, you can do it with like 10 cells. Yeah, it's serious, actually. You can repopulate a whole mouse with 10 bone marrow cells. People, you can't really do it. You need more. But you don't need that many. Good question.
If I were to reject bone marrow, then what would they do?
Oh, so we have a failed bone marrow transplant, right? Now you're really in trouble, right? Because I got rid of your immune system, and the one I put in, the second one, didn't work, actually. If the patient is healthy enough, we can do a double. We can try again, actually. But this is very, very tough because already they failed the first time, actually. In the old days, people used to fail fairly frequently, but now there's some medicines or some drugs that can help it stick a little bit better. So it's not so common anymore. When I was an intern, actually, you know, for some serious cancers, we had failures, maybe 1 out of every 50 or something like that. But now the failure rate is a little bit less. It was a good question. Other questions? I saw some hands. Yes, please.
Going back to your involus and this, you're saying that as we age, we lose that ability to make blood. So is that why as we get older, we're more susceptible to illness?
It's a good question, actually. So it's sort of a balance, right? So as you get older, your thymus involutes. You guys are all right around puberty, right? You guys are right about losing your thymus. Okay. If we did a scan like 5 years ago, you'll have a big juicy thymus, you'd be happy. If we do a scan now, it's probably like halfway gone. So your ability to make new T cells goes down. But on the other hand, you have this beautiful thing called memory. So all the stuff you've already seen, you're remembering now. So you have a less ability to respond to new infections, But you have all this memory, so all the infections that you've seen before, you're pretty good at, actually. So in the end, it goes down a little bit, but it's not so dramatic as you would think. And it's interesting because even though the thymus is gone mostly, you can still respond to vaccines like flu and pneumonia and things like that fairly well. And so there's enough of it left, or enough T cells that it still works.
So is there a higher cure rate for cancer in children than there is in adults because of the thymus being there?
Oh, that's a wonderful question, actually. So if you think about it, it's a little bit as how is important the immune system in different cancers, right? So certain childhood cancers are completely curable, and when you're an adult, they're not. Certain lymphomas and leukemias. Part of that is because of the nature of the cancers, and part of that probably is the immune system. To be fair, like, we work on tumor immunology using the immune system against cancer, but this is not like standard stuff, this is sort of experimental stuff now. So the answer is probably plays a role, but there's probably other factors too. All right, we're gonna have a quiz. You guys ready for a quiz? All right. Yeah, come on. You can keep this on the board, so just get ready. Okay, you're gonna take the AP.
They're not taking the board.
Okay, it's the AP. It's close. It's just it's probably just as stressful, if not more. All right. What leukocyte, white site cell, is the most common in the peripheral blood? Yes, thank you. Okay. So the neutrophil is the most common in the peripheral blood. When you're sick, right? When our good friend Gregory got that evil splinter, and his body was all inflamed, what do you think happens to his white blood cell count? Brilliant. Actually, it goes up. And again, it mostly goes up with neutrophils. You start pumping out immature neutrophils, a whole bunch of them, right? So that's what happens when you're sick. Which lymphocyte is the killer? Brilliant. You guys are great. Well, here's the hard one, okay? This is when you're studying for your APs, you're going to go through these cells. So name the three different ways that cells in the immune system can talk to each other. Just a word. Cytokines. Interleukins. Good, good, very good, actually. You guys are on a roll. Okay, here's a little bit of a thoughtful question. What would happen? What would happen if you were missing all your neutrophils? Exactly. So if a kid was born with no neutrophils, how do you think they would do? Actually, without any neutrophils, you don't usually reach the age of either 1 or 2. You have tons of infections and just die. What do you think we can do to treat them? Correct. So now we're going to do a bone marrow transplant. The other thing that they used to do is just slam them with antibiotics. Right? There's all kinds of antibiotics. It turns out there's also diseases where your neutrophils are like half one, right? And those are kids that sometimes the bone marrow transplant is not without risk. We heard about the problem, the transplant doesn't take. And so some of those kids we try to maintain just on antibiotics, actually. Okay, this is a tricky question, okay? All right? And notice I put cells. Which immune cells play a part in memory? So what did you say? I heard something smart.
Oh, I didn't say it.
Did you say something?
No.
What do you think? What's your guess? Just take a guess. We're all friends. Nobody cares. So cells. What immune cells do we think of when we think of memory? So cells. Yeah, call it. B cells, they're important in antibody-mediated memory, correct? What other kind of cells? CD4 T cells, they're helpers. CD8. Dendritic cells. Okay, and then what initially activated the dendritic cells? Yeah, so they got activated by stuff from the bacteria, also from the macrophages. So it's a kind of a trick question, right? So in one sense, you should say the adaptive immune cells. You should say T cells and B cells, right? But if you think about it logically, which is why you guys are ahead of the game, is it all works together, right? So without the dendritic cells working, you never activated the T cells, right? And without the macrophages and the neutrophils, man, you never got the dendritic cells working, right? So really the right answer is sort of all of them, right? But if you get this on the AP, they probably mean the T cells and the B cells. Okay? That's what I'm thinking. Good. That's all I got. Nope, that's it. That's it. Any questions or anything else? Thanks. Any other last questions? Please.
I'm interested in studying biomedical engineering in college. So how did your undergraduate, major kind of lead you to work?
Yeah, it's an interesting question. So I thought I was going to cure cancer by making machines, better imaging machines and better treatment machines. And it was fun, actually. I mean, you learn a lot of math and a way to think of things systematically, right? But it turned out we didn't really get enough on medicine and biology. So first I had the biomedical engineering degree, and then I went to a program called an MD PhD program. And then I learned the other part. But it still helps me to think of things a little bit more systematically. Like, doing, like my friend over here said, trial and error, doing experiments, right? It's a great question, actually. Anybody else? Please.
So, the whole like chickenpoxing when we got vaccines, but you can use them for like be able to fight off the future. Or they'll have kids who are parents be like, oh, my kid did play with something like chickenpox.
Yeah.
And have chickenpox and then develop their memory that way. And then people who have chickenpox and have it later in life, why would like memory work sometimes better in like certain cases?
Oh, that's a brilliant question, actually. So memory, right? So it's a big question of like memory, particularly the chickenpox. So if you get chickenpox when you're really little, you get really sick, right? When you get really sick, you have a lot of what? We talked about it, the stuff. You have a lot of inflammation, and you're exposed to the natural pathogen. So getting chickenpox when you're young gives you pretty good memory. It turns out that memory to certain things can last your whole life. Whole life. But memory to other things lasts a couple of years, right? So like if you were in the yard and you stepped on like a rusty nail, right? They take you to the emergency room and say, you need a what kind of shot? Right, so tetanus memory doesn't last your whole life, or else they wouldn't want to give you another shot, right? So some memories last your whole life and some only last some time. Honestly, immunologists don't know why, okay? I don't know why. I mean, I want to make cancer vaccines that remember forever. I really don't understand this, and nobody does, actually. Chickenpox is a wonderful example, right? Because when you're young and actually get it, your memory lasts most of your life. When you get the shot, it's not as good, really, and particularly if you get the shot when you're older, right? So there's something about all that inflammation, right, that helps you to make a little bit better memory. And there's also something about being young. One of the things is having a nice juicy thymus, actually. But there's other things too, actually. Again, so it's really tricky, right? And some vaccines, like a flu shot, you get one time, right? Anybody get hepatitis shots? How many times are you going to get that?
Like every couple of years. Right?
Yeah, you got to get it over and over. So that really doesn't have very good memory. And not only that, the first time you usually get 3 of them, right? But shot. So it's like pretty easy to make a reasonable memory to a flu, right? But it's pretty hard to make memory to hepatitis, actually. So memory is a beautiful subject, actually. There are a whole bunch of people spend their whole life studying this stuff. But the answer is, again, younger is better. The actual infection is better. That's a good way to think about it.
Just because we're talking about chickenpox, my grandmother had chickenpox when she was younger, but then she had breast cancer, so she went through chemotherapy, and then she got chickenpox after her chemotherapy.
Yeah.
Would the chemotherapy be one of the reasons that would have wiped out that part of the memories?
So chickenpox is, and our friend identified these viruses. There's viruses, herpes viruses, that you're not really cured. So when your chickenpox goes away, it lives in your nerves, right? It's gone. You're not sick anymore, but there's a little bit of virus living in your nerves. And it tries to grow every once in a while, and your immune system pounds it down, right? So you have an ongoing battle between that, we call it latent, this is living latently, right? As you get older, if something happens to you, sometimes you just get older, actually. Your immune system doesn't work as well. So that happened to my father, too. So he got a little older, and he obviously had some chickenpox, and it comes back to life, actually. It reactivates, and you get this, like, zoster, right? It's worse, right? So it moves along the nerve root. It's actually kind of cool. So if you see a patient, so there's these nerves. So your nerves spread across the back of what's called dermatomes. And what you'll see people with reactivated chickenpox is a stripe that goes right where the dermatome is, actually. It's amazing. So it's following one particular nerve. But you're exactly right. What happened to her was her immune system was good, right? It was keeping the chickenpox at bay, but then she got chemotherapy, the immune system got knocked back a little bit, and the chickenpox can grow out. Absolutely correct. Anybody else? All right, man. Well, great job. You guys had good memory. Maybe you'll remember this for the APs.
He has to get to a meeting at 10, so I'm going to let him go. Did you have a quick question?
Oh, no, I was just
So, thank you so much, you guys. I hope that you learned a lot. See, do
If
you
you have
see why
questions, tell
I
her.
waited to let him do it instead